Hello and welcome back to my channel. In today's video, we're going to look at OSCEs. Now, if you've never heard of them, lucky for you. I'm sure if you've previously had experience with OSCEs in whatever professional background, there can be feelings of dread and fear. OSCEs are an objective, structured clinical examination, a type of examination commonly used in health sciences to assess students. It usually involves some stations where candidates go through, and each station simulates a particular scenario. There are often impartial examiners or actors present acting out a specific role. Candidates are later assessed based on objective criteria depending on how they reacted to that particular scenario. In other words, it's trying in a fair and structured way to look at how you would, as a healthcare professional, deal with situations that can present themselves in the real world. So you can be in a room with that previously harmlessly looking lab teaching assistant that you know quite well suddenly bursting into tears because of a recent bereavement. Or in a room with an actor you've never met before gritting their teeth in rage because of a medicine's error you made. The point is, and where the fear comes, is you don't always know what to expect. One of the common things you can find with OSCEs is that students never really know how to prepare for it because, well, how can you prepare for any possible scenario? Hopefully in this brief video, I can go through 5 tips that might help. So, let's begin. Number 1. If you're lucky before an OSCE, you may have some sort of framework or mock examinations or assessment criteria that gives you an indication of what you're being assessed on. If you do, as with any other assessment, tip number 1 is use these, or any guidance from your examining body. Anything that can help you prepare as best as you can is key here. So if there are criteria that you can familiarize yourself on what you're getting assessed on, this is going to be very important in preparation. Number 2. The second thing which is important to note here is that you're more than likely not going to be assessed purely on knowledge. While this can be intimidating, it's also a plus because it means there are likely going to be easy marks that you can get based on your behavior and your mannerisms alone, and this is something that you can try to work on. This can be things like eye contact, smiling, introducing yourself, giving your name, explaining your role, and what the purpose is of your presence. These can be easy points to get your marks up. So tip number 2 for this would be record yourself or practice with others. Simply by practicing the same behaviors and looking back on it to see where you can improve can give you confidence in how to approach many different situations you may come up with. It might feel awkward at first, but as you get used to it, it should become second nature. If you know what the potential situations can be, such as responding to symptoms, dealing with a patient with a prescription query, taking a medication history, maybe try out different scenarios and record each one. Tip number 3. Never try to blag. OSCEs can be tough, but they are not designed to get you to fail, even though it can seem like it. So unless you do things wrong to the extent that you're harming an individual, or giving completely wrong advice, take your time with it. Quite often, if there is something you have to look up, there may be reference sources available if you need them. The key thing is time management. Take your time and don't worry if you say you need to look something up, but be aware there is a time limit. In my final OSCE in university, although I passed overall, I remember one station where it was pretty straightforward but I ran out of time. It's a shame because just as there are easy points that you can get at the start, there are some you can get at the end with closing statements as well, such as "Thank you for your time. Please refer to the leaflet that comes with these medicines," or "If you have any questions, please feel free to contact us on this number." You'll miss out on these if you run out of time. And one way to better manage time is tip number 4. Familiarize yourself with the reference sources layouts. Now, I'm planning to hopefully go into reference sources in another video in the future, but getting to know what to look for and navigating through them is essential. The key to this is looking at the structure. Yes, in theory any medicines can show up, but the reference sources can be laid out in a similar way. 2 of the big reference sources here are number 1, the BNF. This has the medicine groups as well as the drug monographs for each medicine, and number 2, the EMC. This contains the summary of product characteristics and the patient information leaflets for each medicine. For both of these sources and any other sources that may be relevant, the aim is to familiarize yourself with how they are laid out so that you know, no matter which medicine it is, what it is you are looking for and how you can retrieve that information quickly. Knowing where to look and retrieve the information will help you beyond OSCEs into open book exams in general, as well as when you're working in practice, so it's definitely important. Number 5. Use OSCE case study reference sources if available to see if any of these relate to you. If there are none provided by your assessing body themselves, there are books on OSCEs and case studies within medicine, within pharmacy, within many of the professions that you could be being assessed on. Getting used to different types of cases and mark schemes will do the key thing of increasing confidence and giving you situations to roleplay and record yourself doing. The more experience you set yourself up with, the easier it becomes when it comes to doing the OSCE itself. Again, if you know the sort of topics you'll be having the OSCEs in, focus more on these. If you can't find that much related to OSCEs, or probably in addition to this, there's quite a lot of useful learning on consultation skills in general, and some of these reference sources are used for OSCEs. Of course, it goes without saying, the more familiar you are with the knowledge of the content that you may be examined on, the more prepared you'll feel and the less you'll need to look things up. Depending on how the exam is laid out, it can be difficult to know how to prepare for something where it's one of those exams that can cover any topic you've covered up until this point. But hopefully these key steps will help you to prepare whatever the situation comes up. Remember, the knowledge is an important component of the exam, but that's not the only component that you do get assessed on, and you can score easy marks if you just practice key behaviours in consultation skills. In any case, thanks again for watching. I hope this helps, and if there's anything in particular, please do comment and let me know. As always, if you could like, comment, share and subscribe, and hopefully we'll see you again soon.